Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we insert family critically ill patients in intensive care, so that you can have real power, real control, so that you can influence decision making even if you're not a doctor or a nurse in intensive care. In this week's blog, I want to show you 4 ways on how to be more persuasive if your loved one is critically ill in intensive care. I know how you feel if your loved one has just been admitted to intensive care for critical illness. I know how vulnerable, out of control and powerless you feel. I know the struggles, the pain, the fear and the frustrations you are experiencing. I know how hard it is watching your critically ill loved one suffering and have other people running the show and making decisions without actually asking you. It seems like with your loved one being admitted to intensive care for critical illness, your level of control, power and influence has gone out of the door, and other people might be making death and life decisions without actually involving you in the decision-making process. After all, it's your family member that you dearly love who's critically ill in intensive care. And how do you know that the intensive care team is making the right decisions anyway? How do you know that the intensive care team is presenting your critically ill loved one's condition in the right light? How do you know that the way the intensive care team is presenting your critically ill loved one's condition is not influenced by the politics within the intensive care unit, the financial budget within the intensive care unit, the pressure on beds in intensive care, for example, other admissions awaiting admission to an already fully occupied intensive care unit, and last but not least, the pressure on other scarce resources such as nursing and medical staff, or more or less the lack of such. A negative culture within a unit, for example, where it's often too hard and too difficult to deal with critically ill patients who have a poor prognosis but would get treated differently if the unit had a more positive culture. You can read more about what the doctors and the nurses' behavior in intensive care is telling you about the culture in a unit when you click on this link on the blog. After all, intensive care is a very scary environment, and just because you and your family are scared and intimidated doesn't mean that you are powerless and without control. But if you want to have power, control, and if you want to be in a position where you can influence decision making, you need to be able to learn the right things, throw all your perceptions and preconceived notions about intensive care out of the window. Know that you are not out of control and powerless. Know that you are able to influence decision making even if you're not a doctor or a nurse. Therefore, you need to be able to be more persuasive, and I will show you 4 ways on how to be more persuasive whilst your loved one is critically ill in intensive care, so that you and your family have more power, more control, and so that you are able to influence decision making whilst your loved one is critically ill in intensive care. But wait a minute, you might say, I'm not a doctor or a nurse. How could I possibly be in control, have power and influence decision making? The reality is that you know more than you think you know as a starting point, and the most important questions are often not the clinical questions, and they are often the questions on what's happening behind the scenes, so to speak. Anyway, the 4 things you need to know if you want to be more persuasive whilst your loved one is critically ill in intensive care, that directly lead you to more power, control and influence are: Number 1, don't be intimidated by the doctors and the nurses and take a stand. Yes, that's correct. Don't be intimidated by the doctors and the nurses and their perceived power. Keep in mind, their power is only perceived, and the minute you realize that their power is only perceived, your perception of their power changes, and therefore the perception of their level of power, influence and control changes from being powerful to not so powerful. Number 2, change your perception from you and your family feeling and thinking that you are not so powerful to being powerful, in control and being able to influence decision making. By you changing this perception and by you shifting your feelings will make all the difference. All of a sudden, you will feel more powerful. You will feel that you are in control, and you will feel that you can influence decision making. Number 3. Don't take no for an answer, regardless of the situation you, your family, and your critically ill loved one are in. Now that you've changed your perception and your feelings about how much control you have, how powerful you are, and how influential you are, you also know that you are in a very good position to deal with the adversity and the challenges this situation of your loved one being critically ill in intensive care brings. By now, you know that what you see is often not what you get, and you know that you need to have a good understanding of the moving parts behind the scenes. Find more information on this blog post here, how to make sure that what you see is always what you get whilst your loved one is critically ill in intensive care, by clicking on this link on the blog. Armed with that knowledge, you can pretty much challenge any decision of the intensive care team, which is especially important if your critically ill loved one is in for a long-term stay in intensive care with an uncertain outcome, or if the intensive care team has told you that your loved one is not going to survive. You should always question negative assumptions and negative positioning of the intensive care team. By you changing the perception, the feeling, and the knowledge that you are powerful, in control, and that you are influential, you will see that the dynamics shift and that the dynamics change, and that you will get different treatment from the intensive care team. Number 4. Last but not least, get your hands on our free reports. In our free reports, you learn quickly how to get real power, real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Our free reports help you with in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care. Sign up for your free membership and download your free Instant Impact Report now. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In our free reports, you will also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. 5 killer tips and strategies helping you to get on the right path to control, power, and influence in your situation. You will get crucial behind the scenes insight so that you understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. With your free Instant Impact Report, you'll also get 4 other free reports, and the reports you will be receiving are the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you are not at the bedside with your loved one, 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, 9 myths of being a critically ill patient in intensive care. Thank you so much for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.